Now let's take a look at the M in the mnemonic, which is metabolic. In GI tract, I will also use malabsorption as the M. And two of the conditions, these are usually both seen in the Western population, celiac disease and cystic fibrosis. So you can read more about this in your textbooks. Celiac disease is where there is intolerance to gluten, and this results in an immune reaction in the gut that will ultimately affect its absorptive capabilities. Cystic fibrosis is where there is abnormal or this reduced secretion of the chloride ion, and this eventually leads to very inspissated and thickened excretions, and these become sort of stuck in the pancreatic duct, so that the exocrine function of the pancreas is then not able to occur, and so digestion is affected. So these will ultimately clinically lead to the symptoms of diarrhea in some of these patients, and also they will have nutritional deficiencies due to poor absorption of nutrients. Now, I have actually skipped the I in this mnemonic. The I stands for iatrogenic, which we have covered earlier on. For example, trauma to the bowel due to scoping, esophageal gastroscoping in the upper GI, and colonoscopy. Sometimes it can actually perforate the bowel itself. Other instances of iatrogenic injury or disease would be, for example, NSAIDs giving rise to gastritis or peptic ulcers. And of course, the other I stands for idiopathic, which is we don't really know what's the cause of the particular disease. Now, moving on to the letter N, and this is a very important letter. It stands for neoplastic or neoplasms. Neoplastic conditions, of course, can occur anywhere in the GI tract. In the oral cavity, usually because we know that it is lined by squamous epithelium, we can have squamous dysplasia, and sometimes this can present as a whitish patch or a reddish patch, erythematous patch on the mucosa, and of course, squamous cell carcinoma. In the esophagus, it's also lined by squamous epithelium, and we can have squamous cell carcinomas arising there. But not to forget, the distal esophagus is actually sometimes prone to adenocarcinoma, and this may occur on a background of Barrett's esophagitis. Barrett's esophagitis usually occurs when there is gastroesophageal reflux disease or GERD, and there is a metaplasia of the previously squamous lined lower or distal esophagus into columnar line esophagus, and then developing into intestinal metaplasia, and then dysplasia, and then finally adenocarcinoma. Now in the stomach, the mucosa is actually glandular in nature, so the malignancy will be adenocarcinoma. And this can arise in a background of dysplasia, also previously with intestinal metaplasia, where we actually see goblet cells in the gastric mucosa. And one very important underlying cause or organism is H. pylori. H. pylori, with its chronic gastritis, the patient is predisposed to intestinal metaplasia, and therefore it can eventually have dysplasia and adenocarcinoma. It is also important to note that H. pylori also predisposes the stomach to yet another malignancy, and this is lymphoma, specifically a type of B-cell lymphoma known as malt lymphoma. Now, in the colon, colorectal carcinoma is one of the very common malignancies in our local population, and indeed it is very common worldwide. So some of the clinical symptoms that the patients may present with include bleeding, sometimes obstruction, and even perforation if the tumor actually goes through the full thickness of the colonic wall. Prior to the formation of invasive adenocarcinoma, there may actually be dysplasia to begin with. This is a pre-malignant condition, and adenoma is a growth in the colon. This is also known as an adenomatous polyp. This is like a polypoid projection on the mucosal surface. When we examine it macroscopically, it has some of the features of malignancy, but not quite all of them, and it has not invaded into the basement membrane. So this is known as adenoma, and it is considered a pre-malignant condition. There are other conditions, very importantly, that you must know. For example, familial adenomatous polyposis, or HNPCC, hereditary non-polyposis colonic cancer, colorectal carcinoma. These are inherited syndromes that predispose patients to developing colorectal carcinoma. In FAP, there is a mutation of the APC gene, and this then predisposes the mucosa to malignant transformation, undergoing sequential mutations. And for HNPCC, the main abnormality is with the DNA mismatch repair genes. Now, of course, it is also possible to have mesenchymal tumors or soft tissue tumors in the wall of the gut. These usually don't arise in the mucosa, but rather in the wall. And this is an example would be GIST, which stands for Gastrointestinal Stromal Tumor. So it's a very logical name. And this can occur in the stomach as well as in the colon, in the small bowel also. This is a GIST. In the esophagus, usually the commonest mesenchymal tumor, which I've not written here, is actually smooth muscle in origin, and it's a leiomyoma. In addition to GISTs, there are other types of tumors, and this one of these types would be called the neuroendocrine tumors. So neuroendocrine tumors are a spectrum of tumors with endocrine features, meaning that they contain argentophene granules, or they actually stain on immunohistochemistry in a specific manner, and they can be graded as grade 1 or grade 2 or high grade. These can be found anywhere along the upper or the lower GI tract. And neuroendocrine tumors, it is important to note that they all have the capability to metastasize. Moving on, the C in vitamin C stands for congenital. And the first thing that we're going to talk about in the upper GI tract, this is congenital pyloric stenosis. This is a condition that usually affects firstborn male babies and can result in upper GI obstruction that can be quite severe, can have a lot of vomiting, abdominal distension, and even a palpable abdominal mass. Another congenital condition is tracheoesophageal fistula, and this may sometimes be associated with esophageal atresia. And the malformations here will have varying degrees of severity, which may require surgery. Now, for the lower GI tract, Hirschsprung disease is a disease which gives rise to obstruction in the lower GI tract, and this is because of a stretch of the distal large bowel that is devoid of ganglion cells. So this is also otherwise known as aganglionosis. And as you know, the ganglion cells are very important in order to promote peristalsis, or rather to give rise to peristalsis and therefore downward movement of the fecal material or the bowel contents. So when there is aganglionosis, there's actually a functional obstruction proximal to the area, the zone of aganglionosis, and usually this will give rise to very dilated, distended bowel. Another congenital condition in the lower gastrointestinal tract, and this is usually involving the small bowel, would be, of course, Meckel's diverticulum. Sometimes you can get Meckel's diverticulum. Within that, you can get some ectopic type of mucosa, even things like gastric type of epithelium, and this can actually predispose the patient to having peptic ulcer disease within the Meckel's diverticulum in the small bowel. And the part of the small bowel that is involved is usually the distal ileum. So here in these 2 pages, we have shown you just a very broad overview of some of the etiologic main categories of diseases in the upper as well as the lower GI tract. Of course, this is not a comprehensive chart, and so I would encourage you as you read along your notes and your textbooks to fill in more and more entities as you go along, and this will give you a more complete picture of the spectrum of pathologies that involve the GI tract.